Imagine a community where everyone plays a part in building a brighter future. This is possible through community mobilization. Today, we will explore community mobilization, participatory approaches, and local capacity building in Zambia. Together, we will understand how these concepts create meaningful change. Community mobilization is essential for effective community-based rehabilitation, or CBR. It brings stakeholders together to raise awareness and demand resources. By doing this, communities strengthen participation and achieve self-reliance. In Zambia, communities already have immense untapped skills waiting to be unleashed. The World Health Organization outlines 4 key steps for community mobilization. First, we conduct a situation analysis to understand local contexts and resources available. Next, we build trust through transparency and respect for community leaders. The third step involves raising awareness about disability issues using culturally relevant methods. Finally, we facilitate community action by encouraging participatory planning. Various techniques support successful community mobilization. Community meetings and forums engage citizens collaboratively. Participatory needs assessments allow members to voice their challenges and solutions. One inspiring example is the FUNDISCA program in Colombia. It empowers individuals with disabilities to lead within CBR efforts. Now, let's discuss participatory methodologies. These approaches go beyond consultation and engage community members in power sharing and decision-making. The World Bank emphasizes 3 critical aspects of community empowerment. First, we organize participation through inclusive processes that recognize community diversity. Second, we provide financing through matching grants, enabling communities to control their resources. Finally, we ensure that socially excluded groups participate actively. Participatory needs assessment methods help interventions address real community priorities. Surveys, focus groups, interviews, and community gatherings allow members to contribute ideas. These processes increase program relevance and foster community ownership. Asset mapping is another powerful participatory tool. It identifies community assets, strengths, and resources. This process involves engaging community members to identify assets and mapping them visually. We categorize these resources based on their relevance and capacity to address needs, ensuring strategic planning to leverage them for development. Next, we focus on local capacity building strategies. In Zambia, capacity building goes beyond teaching technical skills. It involves empowering communities to solve their problems. As the World Bank states, existing capacity means the ability to address challenges. Effective strategies for capacity building include training local facilitators to teach others. This was seen in the EWV approach, where champions underwent training to communicate messages effectively. Leadership development equips individuals with disabilities to advocate for their rights. Strengthening organizations supports community-based and disabled people's organizations. Knowledge sharing between communities allows successful approaches to spread. The EWV champion model highlights successful local capacity building. Community-selected leaders receive training to share knowledge with their peers. These leaders, including faith and group leaders, leveraged existing structures for capacity building. In summary, community mobilization, participatory methodologies, and capacity building empower Zambian communities. These principles encourage active participation, foster leadership, and harness existing skills for sustainable development. When communities come together, they can achieve remarkable transformations. ready to make a difference in your community. Start by engaging others and sharing these insights. Let's create a brighter future together.